I'm David Gertz, Brandman Foundation Professor of Cardiac and Pulmonary Diseases of the Faculty of Medicine of the Hebrew University of Jerusalem and Hadassah Medical School, and the Director of Military Medicine. It was indeed a great honor to deliver an invited lecture here this morning in Boston at the 21st World Congress on Heart Disease of the International Academy of Cardiology. It's been a terrific meeting, and I'd like to convey my congratulations and appreciation to Professor Asher Kimchi, the chairman of the session, and the chairman of the International Academy, and his great staff. They did a terrific job. Thank you very much for inviting me. My talk in the plenary session this morning dealt with the role of low-level laser phototherapy for the prevention of progression of abdominal aortic aneurysm. And ever since the U.S. Preventive Services Task Force in 2005 recommended that all males age 65 to 74, whoever smoked, have a one-time ultrasound screening for abdominal aortic aneurysm, we're seeing many more small aneurysms that are less than 4 centimeters in maximum diameter. And this really emphasized the need to identify more effective mechanism-based therapies to prevent the progression of small aneurysms from reaching the stage of obligatory surgical intervention. Basically, up until now, although a variety of pharmacological treatments have been effective in animal models, none of them to date has shown efficacy in humans. And that's what got us interested in low-level laser phototherapy. Low-level laser is a non-thermal light within the visible to near-infrared range of the electromagnetic spectrum. It's been used in the past 50 years or so on an empirical basis for reducing pain in a variety of conditions such as bursitis or Achilles tendonitis, and for acceleration of wound healing, such as situations of diabetic ulcers. It was these anti-inflammatory and pro-wound healing effects of this modality that got us to think that it may be an ideal platform for non-invasive retardation of aneurysm growth, where inflammatory processes and weakening of the arterial wall are the major underlying components. And so, in order to test this, we first looked at the effect that low-level laser has on 2 of the major cell types that are involved in aneurysm progression, the aortic smooth muscle cells and activated macrophages. And what we found was that low-level laser increased proliferation as well as collagen matrix expression and secretion from the porcine aortic smooth muscle cells. And we also found that this modality inhibited the expression and secretion of a variety of inflammatory chemokines and cytokines such as MCP1, IL-1 beta, IL-6, in these LPS activated macrophages. These two projects were published in Lasers in Surgery and Medicine. We then asked ourselves if low-level laser affects these 2 main cell types responsible for aneurysm progression in vitro. Well, will it work in vivo? And so, using the Dougherty model of angiotensin II induced abdominal aortic aneurysm in the apolipoprotein E knockout mouse, we found by high-frequency ultrasound that the low-level laser not only prevented the de novo formation of aneurysms in this model, but also it prevented the further progression of pre-existing aneurysms, which is of additional importance and relevance to what happens clinically. We then found by histomorphometry and immunohistochemistry that low-level laser prevents aneurysm in this model basically by enhancing smooth muscle cell-driven extracellular matrix reinforcement of sites of transmedial defects in the aortic wall that occur at sites near branch points, and these transmedial defects subtend the aneurysm formation in this model. And also this modality seems to modify the timing and the nature of the inflammatory response at these sites. We're now extending these studies to determine the effect of low-level laser on a more molecular level, on the mitochondrial membrane potential before, after, and during incubation of the aortic smooth muscle cells with angiotensin II, using live cell imaging and immunofluorescence staining under standard and confocal fluorescent microscopy. These additional molecular insights should serve as important markers of the efficacy of this photobiomodulatory approach and improve treatment, actually be an additional monitoring feature for assessing outcome. Ultimately, retardation of aneurysm progression in the clinical setting using this photobiomodulatory approach, which is minimally invasive, should prevent patients with small aneurysms from reaching the stage of obligatory surgical or endovascular stenting. Both of these procedures are actually associated with a very high rate of procedure-related complications. And this non-invasive approach would be of particular importance in patients of poor surgical risk. Finally, I'd like to thank the other members of our group, particularly Dr. Lilach Gavish and our colleagues, Professor Ronen Be'eri, Dr. Dan Gilon, Professor Yakov Berlatsky, and Dr. Chen Rubenstein.